This information is independently produced, and all content may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. To begin our discussion, let us review some normal anatomy. This drawing shows the main structures of the female pelvis. The bladder sits under the pubic bone and stores urine from the kidneys. Urine empties out through the channel called the urethra, which opens just below the clitoris at the top part of the vagina. The uterus, or womb, sits below the bladder. The part of the uterus that projects into the vagina is called the cervix. The rectum is right below the vagina and the uterus. This drawing shows the hammock-like layer of muscles called the pelvic floor, which supports the organs in the pelvis, namely the bladder and urethra, the vagina and uterus, and the rectum. When these muscles and supporting tissues are weakened or damaged, the position and function of the organs can change. Weakness of the pelvic floor supports can result in stress urinary incontinence, incontinence of stools or fecal incontinence, and/or pelvic organ prolapse. Stress incontinence describes urine leakage associated with an increase in pressure in the abdomen, such as from coughing, sneezing, lifting, exercise, or sexual activity. It is one of the many types of urinary incontinence. Pelvic prolapse describes bulging of the pelvic organs into the vagina. There are many different names for this depending on which organ is bulging inward. A cystocele occurs when the bladder drops down into the vagina. When the uterus drops down, this is called uterine prolapse. An enterocele is when the small bowel contents bulge into the vagina, and vault prolapse occurs when the top part of the vagina is weak. Finally, a rectocele occurs when the floor or bottom part of the vagina is weak, allowing the rectum to push upward into the vagina. This slide shows graphically 4 of the common types of prolapse. Symptoms of pelvic prolapse include a sense of bulging, pressure, or heaviness in the vagina or pelvic area, pain in the pelvis or low back, difficulty urinating, and difficulty emptying stool out of the rectum with bowel movements. There are 2 broad categories of treatment available for pelvic floor conditions: conservative measures, including behavioral therapy, physical therapy, and devices such as pessaries, and surgery. Treatment efforts may aim to achieve one or more of the following: to decrease the magnitude of stress on the pelvic floor through controlling cough, losing weight, etc., to improve the existing pelvic floor supports through pelvic muscle training or surgery, or to provide new support structures using devices or surgery. This presentation focuses on pelvic floor muscle training and other conservative measures to improve pelvic floor disorders. It is important to understand that whether one chooses physical therapy or surgery for their condition, other measures must be undertaken to achieve success and ensure lasting results. These include education, lifestyle interventions, toileting programs, and bladder training. Education is the cornerstone of all treatment measures, and without a proper understanding of your condition and how treatment works, it may fall short of its potential. We applaud you for viewing this educational presentation and encourage you to make a lifelong commitment to your personal health and wellness education. There are several simple lifestyle changes that one can make, which can have a big impact on bladder symptoms and incontinence. These include fluid and dietary modifications, smoking cessation, weight loss, regulating bowel habits, and physical exercise. The importance of these measures is discussed elsewhere in more detail. Pelvic floor muscle training focuses on increasing awareness and strength of the pelvic floor supports. There are several reasons to do this training. One can better learn to contract the pelvic floor muscles, which strengthens the support of the pelvic organs. This can improve symptoms of prolapse and incontinence in women, prevent it from worsening, and help prevent it from developing to begin with in women who do not already experience it. In doing these exercises, a person can gain the ability to unconsciously contract these muscles. For example, when a sudden urge to urinate comes on or prior to a sudden unexpected sneeze. This, in turn, can improve bladder control and prevent urine leakage. As an added benefit, the increased awareness of these muscles may lead to an increased pleasure during sexual activity. It is difficult to truly know how effective pelvic muscle training is, but it is generally recognized that many women can make at least a 50% improvement. Some women with incontinence can get totally dry. Certainly, success with this type of therapy requires significant motivation and is a lifelong undertaking. Working with a dedicated nurse or therapist can optimize results. There are numerous described techniques of improving pelvic floor tone and strength, most of which have merit. The most commonly employed include pelvic floor muscle exercises, sometimes called Kegel exercises, biofeedback, devices such as weighted cones, and electrical stimulation. Pelvic floor muscle exercises were originally labeled Kegel exercises after the physician who first published papers describing their success over 50 years ago. These can be done alone without assistance or aids, anywhere, anytime. It is important with such exercises to learn to do it right at the beginning in order to gain the maximum benefit from your efforts. A dedicated doctor, nurse, or therapist can help to get you off to a good start. A vaginal exam by your healthcare professional will help get you started and will also help determine if you can proceed with exercises on your own or if you would benefit from working directly with a physiotherapist or nurse specialist. It is important to also understand that these exercises, in order to have a lasting benefit, must be done regularly and lifelong. The keys to succeeding with pelvic floor muscle exercises are to learn to identify the muscles properly and to stay motivated and perform them regularly. To identify your pelvic floor muscles, try squeezing around 2 fingers placed in the vagina, or imagine contracting the muscles that would stop your urine flow. It is important, however, to not try to do these exercises during urination. This is just a method to help you understand the muscles involved. Another way to identify the pelvic floor muscles is to imagine the muscles that you would need to use to fight off the urge to pass gas. If you have doubts about your ability to identify and contract these muscles, it is best to consult your physician or another local expert such as a dedicated incontinence nurse or pelvic physiotherapist. Otherwise, you may be wasting your time. It is a fact that some women simply cannot identify these muscles properly. To begin exercises, first empty your bladder. When you begin doing the exercises, it is important to understand that there are 2 types of contractions to practice: short or quick contractions and long or slow contractions. Contract first slowly for a count of 1, 2, 3, 4, 5. Then relax for the same count. Now repeat this, but with quicker contractions to work the fast twitch fibers. It is equally important to relax the muscle for the same time after each contraction. One set of exercises consists of 5 slow followed by 5 quick contractions. Start by doing 10 sets 3 to 5 times per day. Then increase the number of sets by 5 every week until you can do 10 sets 10 times per day. Start in a reclined position, then seated, and finally standing. Once you are underway, you should begin to notice improvements in 8 weeks or so. If not, revisit your physician. At first, you may only be able to hold a squeeze for 3 or 4 seconds, but with practice, you should be able to squeeze and hold for about 10 seconds. Be sure to relax about 10 seconds also, or more, between each squeeze to allow the muscle to relax. Then squeeze again as firmly as possible, but only using the pelvic floor muscles, not your abdominal muscles. Most people find it easier to start exercises when lying down, then sitting, and finally standing, as mentioned, as you become more comfortable with them. Remember, you must practice daily to make the exercise a habit. Make them part of another daily routine, like brushing your teeth, talking on the phone, walking the dog, or sitting in the car at a red light. You must continue to perform these exercises lifelong to maintain pelvic muscle strength and tone. A maintenance program of exercises 2 or 3 times a day will help keep you dry. If your symptoms become problematic again, then restart the more intense exercises until you again achieve success. Gaining weight, having a baby, or a change in health can all affect your pelvic floor and bladder control. Along with regular exercises, contract your pelvic muscles to control symptoms, to suppress a sudden urge to urinate, to keep it suppressed while walking to the bathroom, and to prevent leakage prior to a cough, sneeze, golf swing, etc. Biofeedback is a type of therapy usually performed by a dedicated pelvic physiotherapist or nurse. The goal of biofeedback is to enhance the effectiveness of pelvic muscle training. Biofeedback uses sensory signals to give feedback as to the effectiveness of an attempted contraction or relaxation of muscles. These signals may be auditory, visual, verbal, or tactile. There are several situations where biofeedback may be of great use. To enhance pelvic muscle training for overactive bladder and urinary incontinence, to improve pelvic floor relaxation during urination, and for treatment of pelvic pain secondary to excess muscle tension. Biofeedback also allows one to quantify muscle strength, which gives important information about where you are starting from and how your therapy is progressing. Typical methods of biofeedback include placing fingers in the vagina or rectum to gauge pressure, use of a probe in the vagina or rectum which is connected to a meter or electrical signaling device called an EMG, and skin patches connected to a similar signaling device. Home devices, such as the one shown here, allow one to measure the strength of pelvic muscle contraction by squeezing the muscles around a probe which is connected to a gauge. This gives feedback on how well one is contracting the muscles. Vaginal weights are another type of biofeedback tool. These cones are simply weights that are placed into the vagina. They are progressively shaped narrower and heavier so that the heaviest one is also the narrowest and thus the most difficult to retain. Patients place the heaviest one they can retain by actively contracting their pelvic muscles in the vagina and attempt to hold it there for at least 10 minutes. Once each weight is mastered, the next heaviest one is used. This needs to be done at least twice a day over a long period of time, just like bodybuilding, to be effective. These are obviously not for everyone, but can be an effective method of pelvic muscle strengthening that can be done at home with minimal supervision. Pelvic floor electrical stimulation is available at some centers. It can be a helpful assist to pelvic floor muscle exercises, but does not replace them. This treatment involves the application of a low-grade electrical current to the pelvic muscles. This serves to stimulate muscle activity and help you identify the muscles to squeeze, to inhibit bladder contractions, thereby reducing the symptoms of overactive bladder, and to improve pelvic muscle relaxation. Pelvic floor electrical stimulation is usually taught by a dedicated clinician such as a doctor, nurse practitioner, or physiotherapist, then is continued at home. The pelvic floor supports the vagina and pelvic organs, namely the bladder, uterus, and rectum. Weakness of these supports can cause leakage of urine and stools, and prolapse or bulging of the organs. Pelvic floor muscle training can prevent and improve these conditions. There are numerous methods of carrying out this training, and professional therapists and nurses can help you achieve the best results. These resources may help you find further information or support about your condition. This is just a sample of modern references discussing pelvic floor conditions and pelvic floor muscle training